Hello, I'm Corporal Sean Benson, and welcome to On the Beat, brought to you by the men and women of the Baltimore County Police Department. This program brings you the latest information on public safety issues in our community and the police department operations. In today's program, we will be speaking with Ms. Victoria Hershfeld and Ms. Kimberlye Ullman about the Baltimore County Crisis Intervention Team. Next, we will spotlight the Baltimore County Police Department's K-9 unit with Lieutenant Joseph Peach. Finally, we need your help in solving a 24-year-old homicide case.
On the beat. On the beat.
Many law enforcement agencies across the country have realized that officers are ill-equipped to deal with the calls involving persons suffering from mental illness. According to the book, Incarceration's Front Door, The Misuse of Jails in America, 40% of individuals suffering from mental illness have either spent time in jail, in prison, or in community corrections. Many times, police officers do not know how to deal with someone in this situation. Traditionally, police training has never addressed mental health issues. Modern law enforcement officers must be equipped with the knowledge, resources, and training to peacefully and safely interact with someone experiencing mental health crisis. The Crisis Intervention Team and the Baltimore County Crisis Response System is a national model that offers training and support to improve police officers' ability to deal with those suffering from mental illness. Here today to discuss alternatives in dealing with someone suffering from mental illness are Ms. Kimberlye Ullman and Ms. Victoria Hershfeld from the Baltimore County Crisis Intervention Team. Thank you to both of you for being on the show today.
Thank you for having us.
Absolutely, thank you. And Victoria, can you describe your position with Baltimore County?
Of course. So in BCCRS, Baltimore County Crisis Response System, I'm a full-time mobile crisis team clinician, and I'm also the CIT coordinator.
Okay. And then Kimberlye, can you also describe your position a little bit different with Baltimore County?
Sure. I am employed through the Baltimore County Police Department as a youth mentor. I work in the Joins program, but I've also I'm helping Tori with planning and preparation of the CIT training.
Okay. And then Victoria, can you tell us a little bit about the Baltimore County Crisis Response System?
Sure. So the Baltimore County Crisis Response System is a collaboration between Affiliated Sante Group, which is a nonprofit, and the Baltimore County Police Department. Together, they create Baltimore County Crisis Response System, which offers an umbrella of services for our community, and it's also funded both state and locally.
Okay, so it's a combination of a private organization along with the government and the police department.
Correct.
Okay,
and it's funded through the Bureau of Behavioral Health, through the Baltimore County Health Department.
Okay, all right. And then when did this program begin in Baltimore County?
BCCRS?
Yes.
BCCRS began in 2001, and then the Crisis Intervention Team began in 2016.
Okay, and what's the function of this system, this whole system together?
Sure. The function of our system is basically to offer we're the linkage between the community and mental health providers. The citizens of the community and mental health providers. So basically what we do is we offer a variety of services. We have our police-based mobile crisis team, we have an urgent care center in our office, we have a 24-hour hotline, and we have our in-home intervention team.
So Victoria, what's the purpose of the system in Baltimore County?
Sure, the purpose of our system is to serve folks in the community who are having a difficult time and possibly in active crises. So we basically triage what's going on in that person's life so that we can deploy whatever type of service that falls under our umbrella so that we can help them when they're in need.
Okay, and this is kind of outside the box of the typical police officer coming, handling a call, and then be done with the situation.
Correct.
Okay. And my next question is, what are to reiterate, some of the teams that are comprised in the system?
Yes. So I'll let Kim talk about our hotline.
Okay, so there is a hotline with the system? Can you describe that?
It's a 24-hour hotline. We have a hotline and a warm line. So the hotline we can triage so we can determine if we need to dispatch our mobile crisis team. So if somebody's in active crisis and they cannot contract for safety, they cannot agree to be safe, they have a plan to harm themselves or someone else, then we will dispatch our mobile crisis team. If we determine that they don't need our mobile crisis team, then we start offering the various services through our office, whether it's coming into our urgent care clinic, it's providing referrals over the phone, or it's just providing support over the phone. So we kind of have different levels of care through our office.
Okay.
And then we always follow up either the next day or a couple of days out just to see if they've called the referrals, to offer additional services, or just to check in to see how they are doing.
Okay, and can you describe the availability of this line?
24 hours, 365 days a year, holidays, weekends, we never close. They will always get a person on the other end. They will not get a recording. Someone will always answer the phone. So they always be greeted by somebody, and then we'll proceed to ask questions, do an intake, and then proceed from there.
Okay, and then can you just give our viewers the hotline number?
Sure. It's 410-931-2214.
Thank you very much. And Victoria, if you can kind of tell us what the goals are of the crisis response system in Baltimore County.
Sure. Our goals are to help folks in the community who are in need, who often might not have direct access to support services in the community. So we can kind of serve as the hub between mental health providers, behavioral health providers within the community, and the citizens of Baltimore County.
Okay, and one of the important parts of this system is the mobile crisis team. Can you describe mobile crisis in Baltimore County?
Absolutely. Our mobile crisis team is a police-based model. So we have a licensed mental health clinician or counselor partnered with a Baltimore County police officer. And the goal of that team is to be able to respond to calls for service when somebody is actively in crisis. That way, we're on scene with them. We can see the environment that they're living in. We can talk to the support or lack thereof on scene, and we're able to do a full assessment of what's going on in their life, possibly assess what behavioral health or mental health issues might be exacerbating or contributing to their current symptoms. And then we try to come up with a plan in order to help them. And the point of all of this, our mobile crisis team, is to divert from using emergency services unnecessarily, to divert from the hospital system as well as the judicial system.
Okay, and Baltimore County has recently announced that it's an expansion of the mobile crisis team. Can you talk about that?
That is right. Although we don't have an exact date and time when the expansion is going to happen, we have a lot of folks in the county and a lot of key stakeholders that are working diligently to make this expansion happen and make sure it's done, the proper way so that we can have 24-hour coverage with our mobile crisis team.
That's great. All right, Kimberlye, I'm going to talk to you a little bit about the training, that crisis intervention training that we see in the county. Can you go into some information about this training that's offered for police officers and even police recruits?
Yeah, sure. It's a 40-hour training. So it's Monday through Friday. We meet with the officers from 7 to 3, and during that training, we have various speakers come in throughout the week and talk on various topics involving behavioral health. So it includes speakers that talk about autism, substance abuse.
So some of the things you go through is scenarios. Can you explain some of the scenarios?
So we do a lot of role playing. We use the scenario rooms at the police training academy. So they go into the rooms and we give them a specific scenario that they have to act out involving some type of behavioral health crisis.
Okay. And one of the interesting things that I've seen in the training is that there's one part that the students place headphones on and they're hearing things. Describe that situation. What's that training? What's that part of the training?
So that is the hearing voices activity. So they have eye shuffles on, and we have various situations that we put them in, and they go around CCBC Dundalk, around the campus, and they'll be walking around the campus. We send them to the library, to the cafeteria. We also have a room where we have board games, and they're playing board games, and they're hearing, all the while they're hearing voices. So it's kind of, it gives them the opportunity to experience what it's like to be a person living with schizophrenia, or where they're hearing things, hearing them say things, they're hearing voices, noises, while going through daily activities. So that's the whole point, is that to kind of see what it's like to go around just their daily routine, but then having to deal with, hearing hearing the voices that someone that has a schizophrenia diagnosis would have to.
You have to go through.
Yes.
And why is this training important?
It's putting them in somebody's shoes to have a better understanding, so when they go on calls and someone is in a crisis where they are experiencing hallucinations or hearing voices, that they have a better understanding what that person has been dealing with, the challenges that they go through possibly on a daily basis.
Okay. And when this training is completed, the officers and the recruits that have received the training, they get a type of certification at the end. Can you describe that?
Yeah, so we provide mental health first aid. It's an 8-hour training where we go over all the basics about mental health disorders. We cover depression, anxiety, suicidal ideation, and at the end of the 8 hours, they have a certification as a mental health first aid trainer. It does not make them a therapist, a psychologist, a doctor, but it just gives them some more tools for their tool belt. And then at the end of the training, they receive a pin that shows that they're a CIT trained officer, and they can wear that proudly on their uniform.
Okay. And how many officers in Baltimore County have been trained to date?
Over 300.
That's great. And we continue to hold trainings throughout the year?
Yes, we've had, this past year, we had 5, and then going into 2019, we will have another 5.
Great. And what we see today in modern law enforcement is that de-escalation during these incidents is very important, trying to prevent these situations from escalating. How does this training assist me as a police officer in de-escalating a situation with someone suffering from mental illness?
We encourage the officers through the training just to kind of slow down a little bit, take their time, kind of assess the situation to see if they kind of pick up that maybe something else is going on. Maybe if the person mentions that they are a veteran or struggling with substance abuse issues, or they possibly could be on the autism spectrum, but through the training they are being exposed to these different situations. So hopefully when they go on a call, they maybe will recognize, hey, this person could possibly, they said they're a veteran, they possibly could be struggling with PTSD. So it kind of maybe gives them a different way of handling the situation, and then hopefully then they will use the skills that they learned through the training during that call.
Okay. So I have to give you both credit. You guys are training seasoned police officers that have seen everything, heard everything. And then the other end of the spectrum is you're training recruits who haven't been on the street one day, have never carried a badge and a gun before. Which one is worse to deal with training-wise?
Well, I don't think either one of them is bad by any means, but each class kind of takes on its own personality. The recruits they're very congealed together because they're a family. They're all going through the police academy together, which is a new experience for them. They're all learning together. Whereas the veteran officers are coming in from different precincts, working different sides of the county, their own different experiences, working with different parts of the community. So each has its own challenges, but I think overall it's been wonderful to see how each attendee grows throughout the week and just increases their knowledge, and you can almost see it click in their heads. Okay, we get it, and maybe we do need to slow down on calls, and maybe there are some underlying issues, behavioral health, mental health, substance abuse, developmental disabilities, that's actually presenting itself right now, whereas maybe before they just thought the person was being non-compliant. So it's getting them to think differently.
Okay. And what are some of the feedback or some of the success stories that we've heard as a result of the training?
Oh my goodness, we get emails, text messages, things posted on social media from all levels, at the recruit level, veteran officers, and just saying, hey, Kim, Tori, guess what? We used our skills today. This is what happened, and it just brings a lot of joy to Kim and I that officers, when they are presented with a situation with somebody in crises or who's struggling, that their training is kicking in and they're remembering what they learned throughout the week.
Okay. And then Kimberly, real quick, with the hotline, we want to encourage our officers to give out this hotline also, but can you describe what's some of the other benefits that we see of the hotline?
It's nice for the officers to be able to give a Baltimore County resident a phone number, somewhere where they can call to talk to somebody that will take the time. So once the officer, speaks with them and then kind of determines what's going on, that they can kind of be able to provide the person with a resource. and we make sure that the officers that go through CIT have Baltimore County Crisis cards. So when they go on the calls, they could just hand them one of our cards or a magnet, and then, or they can even call the hotline with the Baltimore County resident, and then kind of do a warm handoff to a phone counselor.
Okay,
And then we can kind of take over.
Okay, thank you so much. And thank you for both of you for being on the show today. I really appreciate it.
Thank you for having
Thank you,
us.
Sean.
Okay, thank you. You've just heard how Baltimore County is working on alternative methods to peacefully deal with individuals in crisis. This program will hopefully continue to expand and assist the police department in successfully addressing our citizens suffering from mental illness. If you are experiencing issues or you know someone who is, please call the Baltimore County Crisis Response 24-hour hotline at 410-931-2214. Coming up next on our program, we will be featuring our Baltimore County Police Department K-9 unit. But first, this message.